Hey everybody, this is James Gore, April 22nd in the afternoon. Going to give an update on COVID-19 response, coronavirus here in Sonoma County and throughout the region, and also go a little deeper into some other updates. First thing I want to say is I'm going to go through a quick hot minute, and then I'll go into more detail for those who like to go more in detail. So the hot minute is, first of all, testing capabilities drastically increased. We got 5,000 medical swabs in this week. We're expecting 5,000 later this week. We have an order for 100,000 more swabs, and then are trying to get our hands on upwards of 400,000 plus swabs. Reminder to everybody that this was a huge issue for us in the early days and up until just recently with limiting our testing. Is private, public, nonprofit, everybody around, not just our area, but the U.S. and internationally, is competing against each other to get this equipment. And so the access to those swabs is going to allow us to drastically improve our capability to do broadcast screening throughout our community. I anticipate that there'll be an announcement in the coming days about the county looking at doing a drive-up testing for high priority individuals, and there'll be a triage level where if you work in healthcare, if you meet these requirements, if you have these kind of symptoms, we'll bring you in. But the goal is to get all those tests out and keep going and hammering this thing. And that is for the active testing. We are still a few weeks out for getting the other kind of test, which is our antibody testing. And that comes from a blood prick. Where you take a little bit of somebody's blood and you can see if the antibodies are present in their body to where they had COVID before at some time. That'll show what level of penetration was in our community before, and also help public health officers figure out what degree of immunity is being established for those who have already had COVID and might get it again. So that's the big really push right here. The other thing is that we are the shelter-in-place order. We talked at our board meeting on Tuesday. I and the other supervisors pushed hard and got a good response from our health officer, Dr. Mays, about aligning with the state. That means there's going to be some easing on restrictions for construction and other things that are allowed by the state but are a little more restrictive in the county. It also means that we're not going to have an arbitrary timeline for when we remove shelter-in-place. It means that it's going to be linked with the governor's order as a basic area. So I'll get into that a little bit more in a minute, but I want folks to know that what has worked is the idea of us flattening the curve. From every indicator, from an epidemiological standpoint, or from an epidemiology standpoint, with disease spread and disease management itself, is the public health officers are saying that our work of staying at home has worked. And so I want to thank all of you. I want to especially thank those of you who aren't in the greatest situation staying at home. Your paychecks have been impacted. You've lost jobs. Some of you who have small businesses have been horribly impacted to the point where you're wondering if you can keep your businesses open. And some of you live in situations where you don't have a home with space, a place with that's secure, a place where you can be at peace and shelter in place in peace. And so it's brought up all kinds of desires for us to increase our communication and make sure we know if there's violence, if there's abuse, if there's other things going on, and then also our ardent efforts to make sure that we loosen this shelter in place to get the economy back rolling in conjunction with being positive for public health. This is not public health versus the economy. And I want to thank those business leaders out there who are putting together plans that say, this is how we can reopen. This is how we can reopen with best management practices, with hygiene, with social distancing and other things, so that as we loosen shelter in place, we can get into a good position to get business rolling as effective as possible. So we have a lot to go, Sonoma County. We have a lot to go, California. It's going to be a long road. I think what we understand is that as we loosen the shelter-in-place orders, the other thing is that we're going to have cases of COVID in our community. But the key with flattening the curve, if you remember, was for us to create and increase capacity in our healthcare system to be able to manage COVID as it comes in and to live with COVID-19 as the WHO talks about. You can't just shelter in place forever, so you have to actually be in a situation where you keep things going. As many of you know, this is what it's like to not only shelter in place, but parent in place. I love you, Jacob. Yeah, can you say hi to everybody? Hi! Jacob's got a mohawk. Go out and have some fun. I'll be done in a minute, okay? Hey, go for it. Grab it and go outside, and I'll be back, and I'll be there in a minute, okay?
Me, Opal, and Brenna are doing kites.
I'll be right out. I can't wait.
He said he's going to be right out to go to help us.
Hi, everybody. That's perfect. You got to take these blessings also to be, like I've been so much with my kids. I haven't been at events in the evenings. I haven't done, I've been at home snuggling up with my babies. But at the same time, for all of you who aren't in a good situation, let us know what you need and let us know how we can help you. So going forward, the thing I want to really impart upon people is the other stuff that's out there that we're working on. So sheltering in place is going to be loosened, but I can imagine that out of the governor's office and others, it'll be loosened with still provisions in place. Like we're not going to allow large gatherings throughout the summer or of more than 15 people, more than 50 people. So it means places like I've been on calls with our church networks, our interfaith leaders, on how they can host outdoor, social distanced congregations and things. And so I just want everybody to know that there's just diligent work going on every day to try and make this as real as possible. So a couple things that I'm working on in addition is Latino outreach is a big effort. We turned a negative into a positive. We were really concerned in the first couple days about where it was. I've taken on the position on our board for liaison for Latino outreach. Y para todos ustedes que están apoyándonos, gracias más que todo. Es un esfuerzo grande. Estamos exigiendo mucho más en estos días. I just want to say thank you to everybody who's helping us. We have been able to do so much to turn it from a place where we were concerned about outreach to where we're doing good work. Part of this is also requiring employers to provide facial coverings and hygiene to their employees. If you see that there's compliance issues out there, call your local law enforcement, your police, or your sheriff in different areas. This is not a 911 call. This is a call to make sure that people are following the order. In addition, I'm a lead for counties at the state level. I'm the vice president of the California State Association of Counties. And so negotiate with the governor's office consistently. And so we've gone through our property tax negotiations and where we're at. Now we're trying to make sure we get to a good place with the other kind of impacts to all of our budgets so that we can continue to provide vital services and do the best we can. We all know that you all are impacted and many people, hi Opal, go on. And we're all going to do our best to do what we need to do. Other thing I have is fire preparedness. I am creating my own situation out here in my backyard. I'm doing all my pruning. I'm doing all my work. Our vegetation management crews are still out there doing the best that they can. And I have a burn pile that I'm going to take care of. I want all of you to take care of your properties and make sure you're in the best situation possible because we have to realize we don't need compounding disasters. Take care of yourself, take care of your properties. You can be doing home hardening, you can be doing defensible space, you can be preparing your family, and we need to do that. The economic impact is just so paramount that you and I and others can't talk about it. I've had a lot of frustration on emails sent to me. There's a lot of people who think that we did such a good job that we did too good of a job and we overreacted to something that wasn't that big of a deal. And I hear your frustrations. I do not agree with you. For anybody who is an armchair quarterback from their house who's saying that what the whole world, the World Health Organization, what others are saying is correct. Hi, Opal. Your kite flying.
Yeah.
Say hi.
Hi.
That's my sweetie. Go on, hon. I'll be out in a minute, okay?
Okay.
I can't wait. I'll be out in a minute.
Okay.
So, the big part of this is going to be recover fast. We got to make sure that we're in a situation where we're smart, where we support communities to adapt, we streamline permitting and businesses' licenses, and get the heck out of the way of the private sector. That's going to be my biggest goal as we go forward from a county government perspective. Additionally, I just have to say that to our healthcare workers, bravo. I want to thank all of you for being the first responders to what's been going on out here, working relentless hours under not just duress, but difficult situations when you're even looking for masks and other things to take care of yourselves, taking that home. We're here to support you. And I think it's also for everybody, the ultimate irony is that during the middle of a public health crisis, we're having healthcare workers who are being furloughed and laid off because those services, those normal elective surgeries, those service-based model, going to your dermatologist, doing all this other stuff, they haven't been going on. So people are getting furloughed, and this has just been horrible. And so this is going to be a part of what is recover now, recover tomorrow, and continue to recover. Our schools, now my dog just came in. Hi, Choco. Everybody wants a piece of the action. I want to thank Steve Harrington, Dr. Harrington, and our school networks, and all of our local superintendents. And more than that, I want to thank all those awesome teachers who are doing Zoom calls with my kids, who are caring and reading stories on Zoom and doing just amazing stuff. Yes, I know how hard that is. You guys got your school year cut off, and our kids got pulled back to our houses. And then you're trying to figure out how you support us to be good parents and also teach our kids to keep them up to par, and how you hold accountability over parents, but at the same time empower them. So I just, couldn't be more just blessed in that regard. So from that area, I just want to say thank you, everybody. Once again, expect that there's going to be some announcements in the coming days on our shelter-in-place order and changes, and connecting it with the state. There's going to be announcements that come out about expanded testing and ability for you all to get tested and know where you're at. And then there's going to be expanded opportunities for us to hopefully access parklands, not for congregating, but for allowing everybody to take a walk, take a bike ride, and take care of themselves and their community. I'll provide another update early next week, but much love, stay safe. Stay confident, stay vigilant, and we'll do this together.